Hello, my name is Mayara Figueiredo, and I will present a short summary of our paper, which is called Health Data and Fertility Care from an Ecological Perspective. Self-tracking data have originally and typically been seen as individual-driven or self-oriented. Particularly, fertility data are considered very personal and private. However, fertility is entangled with relationships, institutional needs, and societal taboos. And self-tracked data influence and are influenced by the context where they are situated. So inspired by a growing body of research that focuses on collective aspects of health data, we conducted an interview study using the Ecological Systems Theory to explore how data influence and are influenced by fertility larger ecologies of care. Our participants were mostly US-located cis heterosexual couples from middle or high socioeconomic status, and mostly white, Latinx, and East Asian. Therefore, our findings can only speak to the US or Western situations and may not fully represent experiences of minoritized populations. It is likely that there are some similarities, but it is important to make it clear what is the context of this study. That said, due to time limitations, I will use the ecological model to summarize some key aspects, and I hope they motivate you to check our paper later. In the individual level, we describe in the paper the goals, means, and some of the complexities of using data when trying to conceive, including challenges of data collection and analysis, but also the emotional experiences of practicing these activities. The micro layer encompasses individuals' immediate relationships, which included partners, health providers, family and friends, and peers. Data are actively shared in this layer, but with different levels of detail and for different reasons. To give you some examples, with partners, although they are directly involved in the fertility process and they have to act on data tracking results, tracking and analyzing data tends to be performed only by the individual. Health providers, on the other hand, directly receive individuals' data, having to deal with more data than they need and with individuals' engagements with this data. Sharing with peers is also common. In some online communities, they even befriend each other in tracking apps, accessing each other's data, and using this data to drive their interactions. The exo layer includes settings that surround the individual, and in our sample, we identified three main ones: healthcare, work and life, and technology spaces. Data are not directly shared to the first two spaces, but individuals often need to align their interactions within them with their cycles, and consequently with their data. In contrast, the technology space directly connects to personal data tracking. Technology companies define how individuals track their data through their products, and they also store this data. So thus, they influence individuals' fertility trajectory directly. Lastly, the macro layer encompasses broader sociocultural patterns that are manifested in the other layers. In our data, we identified two main ones: lack of knowledge about female fertility and social expectations about gender. The social influences play a role in two main ways. First, they may be brought into the design of technologies and then influence individuals' data work. And second, they can influence how individuals interact with these technologies through internalized sociocultural values and biases that individuals may hold. So as the model helps us to illustrate, data intermediates relationships in the micro layer. The exo layer spaces need to be coordinated with individuals' data, and the macro layer influences the other layers through cultural and societal ideologies that are embedded in institutions, technologies, relationships, and practices that produce, use, and influence data. All these influences generate burden and invisible and intense data work for individuals in two main ways: the direct work with data in the inner layers and the work influenced by data in the outer layers. And in the paper, we discuss how technology supports, limits, and shapes these different types of work. We end the paper discussing that although the outside influences are more structured, our findings also suggest that data and practices from the center of the model can act inside out to influence the outside layers. For example, fertility data work can support learning, which can be important considering the lack of knowledge about female fertility. So we make a few suggestions on how technology could support such activities and could potentially influence the outside layers. Finally, I would like to highlight that this study points to the importance of taking a wide lens when developing and analyzing the influence of self-tracking technologies and focus on more than activities of data collection and use. Because these activities and technologies, they do not exist in isolation, and often involve managing personal data amidst individuals' daily lives and interacting and coordinating with interpersonal relationships with technologies and institutions. So such approaches and frameworks are important to personal informatics and HCI to identify breakdowns that can be tackled by technology, but also to identify their consequences and aspects that technology cannot or should not approach. Thank you so much for your attention, and for more information, please refer to our paper and feel free to contact me.